Welcome back to our series on substance use disorders. This is our final episode for this series, and today we'll be talking about stimulants, tobacco, and a few other substances like anabolic steroids, club drugs, and even some over-the-counter medications. We'll also touch on urine drug screens, which are commonly used in practice. Let's start with stimulants. These include amphetamines like Adderall, meth, Ritalin, and MDMA, and cocaine. They can be snorted, smoked, injected, or taken orally, and they work by speeding up the brain and body. Crack cocaine, for example, hits hard and fast, making it highly addictive. Stimulant use peaks between ages 18 and 34, with men twice as likely as women to be affected. These disorders often overlap with other psychiatric conditions. Depression, anxiety, attention deficit, hyperactivity disorder, and alcohol dependence are all common. Now let's move to tobacco. Despite being legal, tobacco use is one of the biggest global health threats. There are about 1 billion smokers worldwide, and it kills more than 3 million people each year. In the US, about a quarter of adults smoke. Dependence is extremely common. It's the most prevalent psychiatric disorder by lifetime risk. The health toll is staggering. Tobacco is linked to 1 in 4 US deaths, mainly through lung cancer, COPD, and heart disease. Secondhand smoke also raises cancer and heart risk by about 30%. Nicotine works by stimulating acetylcholine receptors, which trigger dopamine release in the brain's reward pathway. That's why it's so addictive. Withdrawal, on the other hand, is tough. Irritability, anxiety, poor sleep, cravings, and increased appetite. Symptoms usually peak after 2 days and can last weeks. Treatments include nicotine replacement, patches, gum, or lozenges, along with medications like bupropion or varenicline. Counseling, CBT, and support groups make a big difference too. Now for some other substances. Anabolic steroids are synthetic testosterone derivatives, often abused to build muscle. They can cause mood changes like aggression, what people call roid rage, and physical risks like liver damage, infertility, and cardiovascular problems. Women may develop permanent changes, such as a deeper voice or menstrual irregularities. Club drugs are another category. MDMA, or ecstasy, produces euphoria and disinhibition, but can also cause dehydration, hyperthermia, and even death. Rohypnol, or roofies, is infamous as a date rape drug because of its sedative and amnestic effects. GHB, another so-called party drug, can cause relaxation, but also coma and respiratory failure. Even over-the-counter medications can be abused. Dextromethorphan, a common cough suppressant, can cause hallucinations and dissociation in high doses. Pseudoephedrine, often found in cold medicine, can be converted into meth, which is why it's regulated. Misuse of these drugs can lead to seizures or death. Finally, urine drug screens are frequently used to detect substance use. Detection times vary. Alcohol clears at about a drink per hour, cocaine for a couple of days, cannabis for up to a month in heavy users, and benzodiazepines or barbiturates even longer. These tests are helpful, but they're just part of the clinical picture. So, to wrap up this episode and our series, let's remember the big picture. Substance use disorders span a wide range of substances, from legal drugs like tobacco and alcohol to illicit substances and even everyday medications. They affect people across all ages and backgrounds, and they often overlap with mental health conditions. The key to addressing them is a mix of medical treatment, psychological support, and above all, empathy. That brings us to the end of our series on substance use disorders. Thanks so much for joining me through these discussions. Whether you're a student, a clinician, or just someone who wants to understand more, I hope this series has helped shed light on the complexity of substance use and the importance of compassionate care. If this review helped simplify a difficult topic, consider subscribing for more high-yield medical education content and let me know in the comments what topic you'd like covered next. Until next time, keep learning, keep growing, and keep expanding your horizons.